Everyone, and happy Thursday. Thank you for joining me. I know normally we do these on Friday, but today we had to change things up a little bit. So I really thank you for watching this and for tuning in. And I am very thrilled to be to welcome Dr. Joon Lee. She is the founder and medical director of SeeBeyond Medicine. It's a next generation medical practice offering uniquely integrated and comprehensive personalized care. Now, at the foundation of Dr. Lee's practice is a process that's called discovery. Discovery, it's an initial analysis, and we're going to let her explain it a little bit as well, which encompasses every element of clinical data, and it is used, including your genetics, your blood, urine, and stool, as well as holistic input. And all that information is used to find and uncover and have tailored personalized treatments to any root conditions, to get to the root condition of so many of these illnesses or maybe conditions that again plague each and every one of us. So we're going to bring her in, Dr. Joon Lee, and as I mentioned, she is Dr. Lee, are you with us?
Hello.
Hi, how are you?
Good. How's it going?
It's going great. You know, I was explaining to followers what exactly is that you do and this holistic input and everything. But I feel, you know what, we're gonna let her say it because she's probably gonna do a way better job than I am explaining it.
Great. I'll take a shot at it. My name
You
is.
take it from there. Yeah. So before we get into the latest craze when it comes to weight loss, it's a step before that, which is we need to get sort of like a whole picture of what's going on with our health, and that's something that you do.
Right. Correct. So, my name is Joon Lee. I'm a medical director beyond medicine. I'm triple board certified in family medicine, integrated medicine, and obesity. I've been doing obesity medicine for the last 15 years. So we've done a lot of weight loss. And over, I guess, 20,000 people have gone through my practice losing weight. Weight loss is an integral part of health. If you want to stay fit, young, lean, we all want to lose weight. 2/3 of America is obese. We want to lose weight, young and fit and healthy.
Mm-hmm. So we do have an obesity epidemic in this country. And can you talk a little bit about why you think specifically here in the US we're having that issue? And one of the bigger issues is we're seeing it as patients that start very young.
Sure. So America is a state, we're all wonderful and great, but we are also surrounded by a lot of sugar, from juice to yogurt to soda, what we drink and what we eat. Bread to pasta to pizza to hamburgers. It's a lot of carbohydrates, right? So I'm actually an immigrant. I come from Asia by heritage. I 2000. And when I got here in 2000, one of the most astonishing thing was actually breakfast. Breakfast is pancakes and cereals, and it's just dessert for breakfast. I was like, what's going on here? Because in Asia, breakfast, lunch, and dinner is exactly the same. It's a well-balanced dinner for breakfast, whereas here we eat a different food for breakfast, carbohydrate. Not only that, but just the portion size is just ginormous. After the pandemic, after the restaurant business went down, the portion size is noticeably smaller. But that's the right portion size. Came here, the pasta dishes were like a wash bath. You could wash your pasta so big. Yeah. It was like 3 people worth of portion served. It was really surprising for me.
So I know that right now, one of the hot topics that we've been talking about as we talk about the obesity and we talk about weight gain, and I feel like the word Ozempic is just in everyone's vocabulary right now. And we're seeing it in the news. We're seeing, we head to the doctor's office. So talk to me a little bit about what is Ozempic? Is it like one drug? Is it a combination of different drugs that fall under that? And what is its purpose?
Correct. So we'll go with the generic name semaglutide, because semaglutide encompasses Ozempic, Victoza, Wegovy, Mounjaro, different brand names. of semaglutide. So semaglutide is an insulin sensitizer, so it makes you sensitive to insulin. It decreases glucagon production, and then it delays gastric emptying. Those are the three main things that it does. So I'm going to go through one by one. When you have the insulin, that means you're able to bring down your sugar level really fast. You eat,
Right.
sugar level goes up, and insulin comes in. That's really produced by our own pancreas. But by taking glutide, the insulin is coming in a little faster and a bit more efficiently, bringing the blood sugar level down fast. So originally it was developed as a diabetes drug, and it was in diabetics. But they noticed every single diabetic who was using semaglutide was losing weight rapidly. So then it got recoined miracle weight loss drug, which injected into your belly or anywhere else weekly, and people
Right.
saying 5, 10, 15% of your body weight within like 10 to 12 weeks. So that's why
Wow.
weight loss. Right? The second thing that the semaglutide does is it delays glucagon. So glucagon is a way in which you're fasting. We actually go to our liver, take sugar out, get blood sugar level up. But if you delay the glucagon, then your blood sugar level, again, even when you're fasting, is going down. So if your blood sugar level low, you're going to lose weight. And
Right.
then the third prominent thing that it does is it makes you full, delays the gastric emptying. So even if you don't eat, you're not hungry. So you kind of,
Right.
and if you do overeat on Ozempic or semaglutide, you may even vomit.
Dr. Lee, I'm sorry to interrupt you, but you're breaking up.
Mm-hmm.
So I can't hear you, everything you're saying. Are you on a Wi-Fi? Are you connected on Wi-Fi?
Yep, I am.
Okay. Maybe can you get a little closer
Yeah.
to the phone, maybe, and see? Because, I mean, you're giving us such wonderful information. And
Okay. Is this any better? I took off me to be Wi-Fi or off the Wi-Fi.
wait,
I hope that's it.
it's kind of breaking up a little bit. I mean, we'll keep going, but I want to just go back to the third thing it does, because I think I lost you a little bit there.
It does. Is this better or no?
Yeah. Is there another area in your office maybe that might be a little better?
This really is the best area usually.
Okay, maybe there. Let's try there, because
Okay, I took the Wi-Fi off, so hopefully that helps.
okay.
But at any rate, the third thing it does is it delays gastric emptying. When it delays gastric emptying, you're full all the time, whether you've eaten or not. And when you overeat, you get punished. You're nauseous, you're vomiting, you're having diarrhea, you're just not pushing the food out the way you used to. So you're always constantly full up to here. So your portion size naturally decreases over time. So that's what people feel the most, that nausea and the fullness.
Okay. So I guess the big question is, because so right now, is it still considered a drug for diabetics, or is it now has transitioned into a weight loss
I think
option?
both. Like we're using it on non-diabetics pretty freely. And even on people who have a low BMI, if they wanted to lose weight, we're starting to use it on people who are overweight,
Right.
not just people who are obese.
Right. Okay. Now, I guess the other part of that is, what happens if you are when you see a patient, how do you put them on a certain plan? How do you know what works for them in terms of a weight loss medicine like this? And then also, what happens when you get off of it?
All right. So generally speaking,
Right.
when I have an obese patient come in, first I actually really investigate what they eat, because ultimately it's what you eat that matters the most. It's not how you exercise. It's not anything else. It's really what you eat.
Right.
So we do a thorough history of a diet history. We take out a lot of the carbs because carbs really equals blood sugar increase.
Right.
Whereas eating a lot of protein, then the blood sugar increase is a little bit more incremental and slow. and you burning a lot more of your own metabolic burning mechanism to even turn that protein and fat into sugar. Whereas simple processed sugar will just go right into your calorie, right into your sort of energy production. Whereas protein and fat requires you to burn a little bit of energy for you to use that into sugar, right? So protein-based diet is really what we promote first. We also say small frequent meals, because small frequent meals does something to your leptin mechanism. I don't know if everybody's familiar with what leptin is. Leptin is basically our satiety hormone, right? It's what signals our brain that we're full, that we leptin also signals how much energy storage we have in our body. So if we have a lot of fat on our body, the leptin should actually let us know and tell us to stop eating. However, with chronic stress, sleep deprivation, and our eating habits, a lot of us have a leptin resistance. So our brain doesn't get it. Like, even though we're eating, because we're eating so fast and we're not giving time for it to signal to our brain, hey, I'm full, I need to stop eating. We don't get that signal pattern so well. So then you get obtuse to that. So if you do small, frequent meals, then you sensitize that feedback loop, because you're eating this much. Really, the size of your fist is what I tell my patients. Nothing bigger than that.
That's what that should be your meal, or like the protein.
Small, isn't it?
Yeah,
it's really astonishingly small. But if you eat a small amount, a size of your fist, every 3 hours, you're actually able to sensitize your leptin feedback loop, and ultimately you train your belly to be really full with a very small amount, right? So if the portion size is small, you keep your bloodstream pretty steady. Instead of a big meal, big sugar surge, and then like fasting for a long while, we actually at SeeBeyond Medicine like small frequent meals that are protein or fat based, keto, as opposed to carbohydrate based. So those are the fundamentals in the diet that we recommend. And then if the diet fails, then we usually go to supplements and nutraceuticals first. We use the gentle stuff first. And then if that doesn't work, then we resort to medication. Medication is always the last resort. Because the semaglutide or Ozempic has been so popular, there's big demand on everybody wanting semaglutide or Ozempic. But I would warn you against jumping into semaglutide or Ozempic, because if you could do it with just diet habit change one-on-one, why put yourself at a risk of constipation, gallbladder stone, pancreatitis, syncopal episodes? You know, there's definitely suffering that's involved with that Ozempic weight loss.
And I want to get into that. There was something you were saying as you talked about how you tailored these plans when you meet with a patient. So you obviously, it's a keto focus. So your thoughts on how does the calorie intake affect that, one? And on the other hand, what about, you mentioned very quickly, fasting. So
I'll dissect that. So calorie in and out and calorie restriction for weight loss is a myth. I'm going to say it again. Calorie restriction does not work for weight loss.
Okay. Why?
It should, but it doesn't, because our body so fascinatingly, amazingly can balance your sort of energy intake and what is supposed to be. Your metabolic set point is what you really need to change. So if your metabolic set point is set in a way that it's anabolic, meaning you're in a phase where you're storing, even if you just drink water, you're going to gain weight.
Wow.
There are people who says that, right? I don't eat much, but I'm gaining weight. Why?
Right.
I don't really eat much. My friend, my sister is eating like a horse, but I don't eat much, but I gain weight and she doesn't, because their metabolic set point is different. Like her sister, her metabolic set point is high. So she's in a cycle of using it, catabolic. Eat it, use it, eat it, use it, eat it, use it. It's an efficient system where the thermogenicity of your body is high. Your body is awake. You're burning energy very easily. Whereas the person who's gaining weight on water or a cup of coffee is kind of like the metabolic set point in the body is withdrawn and shut down. So it's constantly just keeping it on, and it's not burning it high enough. That happens when you don't eat enough. That happens when you exercise enough. That happens when you're like highly stressed and your cortisol hormone is really, really high. So obesity or overweight or gaining weight is really not about caloric restriction or like over calorie. It's really about balancing your hormone out and setting your set point high so that you have a system of calorie in, calorie out, burning in, burning out. Like my friends call me groceries because I carry food everywhere and I eat so much.
That's a great nickname. I mean,
I'm constantly eating, but I'm constantly hungry, but I'm also constantly full after eating a little bit.
Right.
What it was good for is because even if you eat a little bit, you get full so fast.
Yes.
You develop a new habit of eating small amount and feeling full. The only caveat to that is because you're so full, you end up not eating at all. And if you end up not eating at all throughout the whole day, then you end up having a syncopal episode or hypoglycemic episode where you might faint, right? So you do have to remind yourself, even when you're on Ozempic and even when you're trying to lose weight by eating less, to constantly feed your body something to keep that metabolism up, especially protein. Because if you don't eat enough protein and you're actually resorting to a small candy or small fruit or small carbohydrate to kind of keep yourself energized, what happens is because of the rapid weight loss, you lose more muscle mass than fat mass. But body composition is super important. You want to keep your muscle because that's your energy production.
Right.
Not only is that's the only metabolic tissue that can burn fat even when you're asleep, right? So if you lose your muscle mass, you may be losing weight, but you're not losing the right stuff. So it's super important to continue to feed yourself, even if you're on Ozempic, but with small amounts of protein.
So if you are on that medication or anything under that category, do you suggest to patients that even when they're not hungry, if they know they haven't eaten in a while, should they be looking at the clock or saying, maybe I should add a little something to my body even if I'm not hungry?
Correct. So our body is a machine and it responds really well to routine. You know how like certain machines, if you program it a certain way, it's going to work a certain way?
Right.
So is our body. So if you program it with protein, a small amount of protein every 3 hours, you're going to lose weight whether you're on Ozempic or not. But even when you're on Ozempic, you want to be feeding your body a small amount of protein every 3 to 4 hours to keep that energy level up, keep that metabolism up, and to not lose muscle mass.
Okay. This is unbelievable. This is so fascinating to me. I mean, just like everything as you're speaking it, and just things that we learn about how to properly eat, like how it affects our body, what's muscle mass, what's fat mass, and it's just how it all works together is incredible because you have to have the right tools and the right knowledge.
Totally. I mean, intermittent fasting does work for some people because people who cannot control their portion size, they need to control the time frame in which they eat.
Right.
In groups of people, it's a wonderful thing because they don't feel like eating breakfast. It's easy for them to skip lunch, and having one meal a day just like fits their lifestyle. Not having to worry about what to eat is just easier for them. But if you pay attention to what you eat, I think you get better long-term result.
So the question would be, Dr. Lee, so once you put a patient on a medication like this as the last resort, is this a medication that you are supposed to be on for the rest of your life? Or is this a medication that you give a patient for a certain amount of time?
So that is a fantastic question. We've been kind of doing it both ways. I mean, Victoza has been around forever. Just Ozempic is getting so much marketing and like buzz behind it, but it's usually is a lifelong medication for diabetics, just
Right.
like your blood medication. It's chronic medication. For weight loss, you could use it both ways. If you are somebody, so there's different types of obesity. Let me just dial back,
Yes.
educate a little bit. There's different types of obesity. There's the obesity that comes from a genetic mold. My mom was obese, my dad was obese, my uncle's obese. I was born big framed. I've always been big framed and chunky. It's just never changed in my life. This is who I am. It's a genetic thing, right?
Mm-hmm.
There's the stress type obesity, where when you take a history where they gained a lot of weight suddenly when they went to college. They had a freshman 20. Their living environment changed.
Right.
They started alcohol. So they started gaining weight around their 20s when they start becoming independent and get stressed out about life. And they also, gained a lot of weight when there were a lot of under a lot of work pressure, or their history is pretty clear. It's quarter
Right.
driving the weight gain. And then there's the menopausal, andropausal weight gain, where in their 40s and their 50s, as they lose their sex hormone, they're like, I never had a belly, but now, like, I hit 50, my period is gone, my waistline is gone, and now I feel bloated and swollen in the middle. That's a very typical story of a menopausal woman coming in with an extra 15, 20 pounds as they lose their sex hormones. Their body changes. So depending on what type of obesity that they have, which can only be sort of distinguished with like a careful history taking, we call it the weight history. You want to kind of take, like, even plot it out in a graph of like age and like events and the weight, and kind of see what the patterns are in their weight gain is. Then you can easily see, was that a genetic type of obesity? Was that a stress type of obesity?
Right.
Loss of sex hormone types of obesity. And depending on where it's from, you want to go to the root cause of what it's about and really treat the root cause. And that's what makes a successful weight loss practice versus like a generic give Ozempic to everyone kind of a practice. Right?
Like, we're going to get to the issue. Where is the weight gain coming from, as you said?
Right. So then you want to get to the root cause of it. If it's stress and sleep deprivation, you really want to give the patient tools to de-stress and like sleep well. And once they de-stress and sleep well and get their life in routine, they will naturally lose weight, right? If it's menopause that's causing it, you need that sex hormones to get that curvature back, right?
Right.
Estrogen to have our sort of like the womanly body, and we need that androgen and testosterone to have that like big shoulder muscular body in males. So then you give that back, then it just solves that obesity problem.
So then based on that, that's how you determine how long you use a medication for, if it has to be lifelong, if it has to be monthly.
Oh yeah, I actually got the question, obviously.
No, but I needed this background. I think it's so important to know that it's not just, hey, take this. There has to be an understanding.
Yes, I was trying to give you a background.
Yes, and thank you. Thank you.
Okay, so thanks for reminding me. So it's a genetically based thing. That's nothing different than diabetes, is it? And high blood pressure, right? So that's probably a lifelong medication for that person. That person was always obese. Now, obesity is a disease, just like diabetes, just like high blood pressure. Then that medication should support this person forever, lifelong. And that's probably the only way that the weight is going to maintain in a way that it's a normal range, just like blood pressure. Like blood pressure is only going to maintain in the normal range when you take the blood pressure medication, right? So that genetic type of people, Ozempic, semaglutide, once you start it, probably shouldn't get off it. Consider it like a blood pressure med or a diabetes. But if it's a stress type of people, if you give them a crutch, like a cane to just sort of start walking, like a tool to start, organizing the life, and like eat small portions and protein and give Ozempic so that they can reduce the portion size and whatnot, then it's a finite amount of time. Now, all the semaglutide studies are based on a year and a half of following the participants.
Wow. Okay.
I usually tell my patients, plan to be on it for 2 years at least. It really depends on how much weight we're trying to lose. Like it could be 20 pounds, it could be 80 pounds, right?
Mm-hmm.
Like pushing patients to lose more than 1 or 2 pounds a week. But with Ozempic, you end up losing like 4 pounds a week sometimes in the beginning. It's very
Right.
rapid. But it's really not good to be having a rapid weight loss, because rapid weight loss means rapid weight gain when you get off it, right? So
And is it one of the
yeah,
issues of Ozempic or one of these
right,
medications is the moment you get off, unless you're not eating the way properly, you're going to see that weight gain, right?
right. So we keep them on the Ozempic for at least like a year, year and a half, see that it's maintained for a very long time. And just like when we start the Ozempic, we titrate it up week by week over
Right.
3 months. And as we titrate it up, we find what dose works best. Just like we did that when we taper people off, we titrate it down. And as we titrate it down, we track whether or not there's a rapid weight gain or not. And then we talk to our patients to see if their lifestyle is drastically changing, because their appetite will come up. They're going to want to drink alcohol again because alcohol is so prevalent in this American life.
Yeah.
You know, alcohol is a big source of like empty sugar calories that goes into our body, right? But with semaglutide or Ozempic, alcohol has to be stopped because it increases the chance of pancreatitis. So you'll end up in the emergency room if you're on the semaglutide and drink.
Right.
Your pancreas overload, right? So we make sure in the beginning we tell our people not to drink alcohol if you're on semaglutide. So,
Mm-hmm.
you know, once you're on semaglutide, you end up wanting to celebrate. It's somebody's birthday, it's summer barbecue, you want to have beer, or you want to have a glass of wine, and then that slowly seeps back in. And as your lifestyle or your body allows you to actually eat a little more or drink a little more, it's you know, your weight is bound to come back up.
Right.
So we do at least a year and a half to 2 years to maintain the weight and the lifestyle and the habit to really stick so that it doesn't change. And then we titrate it down slowly so that we kind of see, is it really time to stop it? Because if you stop it abruptly, it's a done deal. You'll gain.
Right. The side effects, because I mean, as miraculous as this medication sounds, every medicine or every treatment might come with side effects. Have there been, if you're taking one of these types of medication?
Right. So nausea and fullness is the most common one. You feel nauseous when you eat. So
Mm-hmm.
this like food aversion. You don't feel like eating anymore, because if you eat food, you used to get pleasure. That feeds into a loop back cycle of wanting to eat.
Right.
But if you eat food, you feel bad, then it feeds into a loop back cycle of like, hey, that's a negative feedback cycle. I don't want to eat anymore, right? So you end up decreasing your portion size further. So nausea is a big one, and you're just really full. You feel like food is in your throat. You end up just not eating because you feel full all the time.
Right.
And by much sooner.
Mm-hmm.
So that's that. Constipation is a pretty hard side effects that a lot of people battle with. We do recommend when we start semaglutide, magnesium citrate, colon detox, like fibrous food, you know, things that can help with like constipation, because
Mm-hmm.
that if you don't eat much, then nothing's going to come out, and it's tough for the patient who can't poop. So general,
it's important. It's very healthy. We need to get those bowel movements going. That's what helps cleanse our system.
Right. I tell my patients that you need to pee, poop, and sweat every day for all of your detoxification organs to work. Like our skin is our biggest detoxification organ, right? So if you're not sweating every day, you're actually not eliminating toxins every day. You know, everybody,
that's a great point.
But you know, not everybody poops every day, but if you can train your body to poop every day, it's a very good thing for your detoxification.
Absolutely. Okay, I wanted to mention, because as we wrap, I do want to know what the long-term goal is when you see patients, Dr. Lee. What is it? What's the expectation? What's the goal when you work with a patient?
So it's very easy to lose weight. Losing weight is easy. That's not that hard. What's hard is maintaining
Right.
Maintaining is hard. There's so many people, including us, that's like fluctuated with weight. We lost it, but we couldn't maintain it, so we yo-yo back. Our goal at SeeBeyond is to stop that yo-yoing through education and through identifying the root cause. So if you identify the root cause and you really truly understand your biochemistry and why I gained the weight, then it'll be far more effective for you to maintain that weight loss.
Okay. That makes so much sense. I think that so many people have, especially patients, may come in and have a misconception of where their weight gain comes from. Or you do hear many people say, it's so hard for me to lose weight.
Right. So it might have been like dismissive for me to say it's so easy to. It is really easy with
No,
Ozempic.
I know. No, wait. When I say no, that's why I'm saying, as you say, that it's so easy to lose weight. Yet all of us always feel like it's so difficult, and it's probably because we're doing it wrong.
That's because you don't know why. You got to figure out the first. Once you know the why, it's like putting a key to a lock and unlocking it, as opposed to trying to open something without a key.
You're absolutely right.
So as long as you know your genetics, and as long as you have a thorough blood work and a history taking, and you know what your hormones are, weight loss becomes really simple and easy.
And that's something that a patient, if they're listening to this and they want to get more information, how would they do that? How would they learn more about SeeBeyond medicine?
So SeeBeyond is like founded under the premise of like really listening to our patient and really seeing the patient for who they are, so that we can actually figure out who they are and why they are the way they are, right? So we're based practice out of New York, but we have plenty of snowbirds in Florida. We have people in California. We have people in Europe even. So we do a lot of medicine. We send out testing kits, and genetic testing is often saliva or cheek swab. So that's enough. And if we need blood, we send you to the local Quest or LabCorp to get your blood work done. And once we have your blood work and your genetics, a lot of the times we can solve the problem. We got the key now,
Yes.
But once we educate you on what your key is, which is different for everyone, once you have the key, then you have that knowledge to go on and maintain that weight loss. And this round, your weight loss should be permanent. And your weight loss, Ozempic is merely one more tool to get there fast.
Right.
But without knowing the why, it's really tough to maintain. You gain it right back when you're off it.
Yes, exactly. Thank you so much, Dr. Lee. It has been such a pleasure to speak to you. And did you say you're based in New York?
Yeah, we're based off of New York.
And so am I. And I am really interested. I want to learn about my genetics, and I want to know all that root conditions of different causes. I definitely want to explore that a little more, and that makes me excited that you're here, but you're everywhere. So thank you so much, because I think there's so much information out there about this weight loss Ozempic craze, and you have given us so many tools and feedback. So very grateful here at the Health Channel.
Come see us. We're pretty good.
So no, I think you're great. Thank you so much.
All righty. Bye now.
Bye-bye.